New tonight at 11, the Center for Medicare and Medicaid Services distributed $50 billion aimed at helping rural health care. After the announcement, we had a chance to talk with the administrator, Dr. Mehmet Oz, who explained what this initiative is all about. In an effort to strengthen health care in rural areas throughout the country, the Center for Medicaid and Medicare Services has established the Rural Health Transformation Program.
60 million Americans living in what we consider rural areas. Their healthcare system wasn't able to keep up. Chronic disease was skyrocketing. And so the president and Congress decided to go ahead and give $50 billion to completely change the program for the better.
CMS Administrator Dr. Mehmet Oz explained that the $50 billion will go to the state's governor and will be allocated over the next 5 years.
Every year you get 1/5 of the money. You got the first 1/5 today. All the money's gone, by the way, I can announce. So every state has their first year's allotment. Every October we'll give another year's worth of money, but there's some strings attached. For example, if you don't do the things you promised to do when you applied to us, we're going to take some of the money back. This is actually not to threaten the states, it's to help the governors. Why? Because if Governor Shapiro says, you know what, we promised that we were going to do the president's fitness test in all our high schools, or we promised that we're going to make sure that SNAP foods are healthy when we give them to people so they aren't poisoning themselves with the money that we're helping them with. Those are the kinds of things that get you points. If you say you're going to do that and then you don't do it, we're going to take the money back. So this way the governor can tell everybody, hey, listen, legislature, wake up.
And one of the strategies of the program that Oz said he's focusing on is modernizing infrastructure and technology.
You've got states coming up with brilliant new ideas to address their specific problems. I'll give you an example. Alaska, right? It's this time of year. Forget about Erie. You cannot go outside in many parts of Alaska. So they're going to use drones to deliver medications. Pretty clever. In the southeast part of the country, we've got states where there are many counties without an obstetrician. They're going to use robotic ultrasound these devices to get that data so they can feed it back to the major medical center and give doctors an idea of how that mom is doing with her baby without her having to drive 2 hours across state. These are the innovative ideas that are coming because states know they got enough money to make the investment.
And over $193,000 from the Rural Health Transformation Program was allocated to Pennsylvania.